give passport or contract. But if he doesn't implement this plan that was proposed by the House and the Senate, and he proposed himself, there's two things that can happen. He can propose a plan that will be drastically worse as far as the benefit levels that public employees have and cause a lot of issues and try to politicize it, or he can put a program in that won't have the savings that this House Senate agreed health insurance plan did, and then we have an unfunded mandate really on all these local governments out there and everyone else that are going to have to, ultimately, pay the piper. And we were able to run this money through the system with this plan and pick up matching funds off federal programs and other programs to help do this. So it's a terrible mistake in policy, and it's inexplicable to me. And I think this was one of the major parts. You cannot continue to have the general population, the taxpayers, not to have a health care plan out there that is as affordable as the public employees that they're paying, and continue to explain that to people. So it's a terrible problem, and I'm waiting to see what he does about it.
Mr. Speaker, seriously, did you have a conversation with the governor either?
No.
When he did, since then?
No, I didn't.
Well, why do you understand that the veto was?
I don't know the answer to that. And I do know that, and what President Williams says is correct. What happens, because the state is a self-insured entity, we can't just go out, we don't know exactly what those fixed costs are. And there's a board that was created back, I believe, during Governor Fletcher's administration, that actually dictates the type of policies that will be offered. And what they had done was to offer the so-called upscale or better coverages, use their money to make an incentive for people to go into those programs rather than the basic program. The state's responsibility to its employees is to provide free of charge a basic health insurance policy. But if you looked at the numbers, there were only like 7 or 8% of the people that had the basic plan, and everybody else was getting this optimum plan. And it's true, the optimum plan coverage was better, and hence it was more expensive. And what the actuaries said was, if you don't put into the budget exactly what your base plan is, then we can't book any direct savings, because since you're self-insured, if you have an optimum plan over here, and even though they say it's going to cost X amount of dollars, if it costs more than that, then the agencies and the entities whose employees are covered, hence the state, has to pay the bill.
It was still a nice plan.
It was still a nice plan. It was a very nice plan. As a matter of fact, it was probably better for the folks on the lower end, the janitors and the bus drivers and the people like that. It was a better plan for them because it didn't cost them anything. And to provide the same coverage in the optimum plan, our actuary said, I believe it was David, $12 or $15 a month, extra. So it wasn't cost prohibitive to do it the way that we did it. And I'm not sure why the governor did it. My guess is, my speculation is that some of the interest groups did pressure him, because they came to us at the very end of the session and said, well, why don't you let us spend the money? We can show you savings. And so I guess it's just, we'll have to look at it come January, and then January of 12, and see exactly what happened. But that's the problem. That's the problem in a nutshell. We have to at some point go back to where we understand what our responsibility is, and that is to provide a basic plan free of charge. It's not to provide optimum plans. It's not to provide a lot of this coverage. We actually partially subsidize some of the optimum type plans with state dollars. Now, I don't know of anywhere in the private sector that's done. I mean, people should have a plan. If they want to buy up to an optimum plan, they can do so. There's no question about that. But that is not the choice that the state makes for them as their employer. That's a choice they make themselves.
The health insurance and retirement benefits are a bone of contention in every state across the union. Many states do not provide health insurance at the level that Kentucky does. We provide health insurance at a greater level as part of our compensation package than many states. And most states don't provide retirees health insurance benefits at the level, especially when they're between the early retirement ages that we'll get to, I'm sure, and when we talk about the pensions in a few minutes, from the time people retire from state government now until they're eligible for Medicare and get a Medicare supplement plan that we help them provide or they buy on their own. We provide that health care insurance to qualified retirees, and that's a very extensive group. When the minimum retirement age without penalty for people that are presently working, not the new hires where we adjusted somewhat, you can enter into employment in state government at age 20, work for 27 years, and age 47 be retired without penalty. You don't get as large a retirement, but without penalty on what you've earned. And the state government has to provide you health insurance until you are Medicare eligible, and that's gets us involved into what is called the inviolable contract, which we'll get to, that some courts have said that we cannot change the retirement package that exists for public employees once they are hired. The day they're hired into employment in the Commonwealth of Kentucky, whatever benefits were there, and strangely enough, whatever contribution they were required to make into their retirement situation, has to remain constant, and that's what the case law in Kentucky is right now. And all over the country, there is this battle going on between public employee unions and Republican and Democrat legislators and executives. It's not a partisan battle that's going on. If you go to New Jersey, the president of the Senate up there spent his entire life working for a private sector union, but he's in a battle with the public employee union up there in concert with the new Republican governor, Governor Christie up there, trying to do something. And I'm convinced that the speaker is right. The primary moving public employee union in the state of Kentucky is the Jefferson County Teachers Association. They're the strongest. I won't ask you who came to see you, but they didn't come see me. But in any event, they have a lot of influence, and the teachers union in this state puts a lot of money out in political races around the state, and their endorsement is sought after, particularly in primaries for the governor's office. So this is a battle not only on the health insurance side that we're going to get involved in, but also on the pension thing that I'm sure you'll get to, and I'd like the speaker to answer the pension question first.
Mr. Speaker, let's go to that now, just because we want to get a few more of these very important issues in, and the pension system. Whether you've made some improvements, you've made some changes, you've had many committee meetings on it, and subcommittees are studying this. Is it on the right track, Mr. Speaker, which is probably too broad and general, but is it on the right track? And will there, would you advocate for additional changes in study?
It's on the mend, but it's not well, is probably the best way to look at it. Our systems, like every other systems, like private systems, because of the financial problems in the stock market, have lost a tremendous amount of their value over the past year and a half. And actuarially, what had been assumed when we funded these systems, the growth rates were not achieved. They were actually underachieved. They lost money instead of gained money. I think we assumed about a 7 point whatever it is percent growth rate traditionally, somewhere in that range. Well, actually, they've lost about 2 or 3%. So it's about a 10-point swing, 10% swing. And you know, in terms of dollars, it's about somewhere in the neighborhood of $3 to $4 billion probably. Now, some of that's coming back, as we all know, but the underlying issue is what happens if you have a guaranteed contract that the courts have recognized and you have these swings, or you have, that the General Assembly didn't just underfund because it wanted to be mean to public employees. Every time that the General Assembly didn't meet what the employee union may say was the required contribution, we had an actuarial study done. And the actuarial study looked and said, here's what you can pay less. In other words, you know, because the stocks were outperforming what had been assumed during certain times of growth in the market, we chose not to put as much money in to keep the system sound. So it wasn't like we didn't have data. It wasn't like we just went out and did it for, you know, for the fun of it. We had actuaries who looked at that and gave us the information. That was the best information that we had at the time, and we had a right, I think, to rely upon it. But the problem becomes what happens in times like these when you have this requirement that